The latest CDC tracking data on bird flu suggests the virus may be spreading undetected among humans. We also learned this weekend that the number of hospitalizations is up to 4. That doesn't seem like much, and it isn't, but the worry is if the virus is left unchecked, a more substantial health crisis could be looming. Joining me now is CBS News medical contributor and editor-at-large for public health at KFF Health News, Dr. Celine Gounder. Doctor, it's good to be with you again. I just said that about cases. Is that right? Is that the thing to worry about, the bird flu? Not so much individuals, but the fact that it's changing a lot and what that means.
Yeah, I think to answer that question, it would be helpful for people to understand how the virus can change to lead to a bird flu pandemic. So we have a graphic we're going to show on screen here. The bird flu can infect birds as well as mammals, including pigs, cattle, and cats. People can also get infected with the bird flu when they come into close contact with infected animals. So farm workers, for example, are at high risk for infection. At the same time, people can get infected with the regular human flu during winter flu season. So a person could get infected with both the human flu and the bird flu at the same time, especially if, say, they're a farm worker or someone else who comes into close contact with infected animals. Now, the flu is made up of 8 different pieces of genetic material. And when you have different flu strains that infect a person or an animal, at the same time, those flu strains can swap parts. And that's how you get a new hybrid flu strain. And these new hybrid flu strains, they can potentially transmit from person to person and trigger a pandemic.
Right, so we become just this blender in which all of it's mixed up and the new thing comes out. The CDC had been reportedly tracking this bird flu with 2 studies that got stuck in the administration's effort to do a variety of things, but never got out. How much did that concern you that those reports didn't get out?
Well, it's concerning because even with the end of the communications pause, those 2, what they're called MMWR, so these are weekly reports that come out from the CDC, have done so for decades. And this is how the CDC communicates scientific developments with doctors, scientists, people in the field. And those 2 publications are still held up. And one of those reportedly shows that there's been bird flu transmission among cattle that is going under the radar. And this is concerning because this is not the first time also that we've seen political interference with the CDC's weekly publication. This also happened during the COVID pandemic to make the situation with COVID seem rosier than it was. And this is really not what you would call transparency. We need transparency to know, all of us, how to respond.